A sudden resurgence of Ebola has put the Democratic Republic of the Congo, DRC, on high alert. This is a health crisis demanding urgent attention. Just this week, officials confirmed an outbreak of Ebola virus disease in Kasai Province, leaving communities anxious and health authorities scrambling to contain it. As of September 4, 2025, there have been 28 suspected cases and 15 tragic deaths, including 4 frontline health workers in the affected region. And here's where it gets controversial. Can fast deployments and vaccines outpace the speed of viral transmission? The epicenter of the outbreak is in the Bolape and Mweka health zones of Kasai. Health workers became alarmed when several people began to exhibit classic Ebola symptoms, such as persistent fever, uncontrollable vomiting, severe diarrhea, and even bleeding. Following these ominous signs, the National Institute of Biomedical Research in Kinshasa ran laboratory analyses on samples collected on September 3. Their conclusion was crystal clear. The culprit is the Ebola Zaire strain, notorious for fueling some of the deadliest outbreaks in history. Swift action is underway. A national rapid response team, supported by World Health Organization (WHO), specialists in epidemic management, infection control, medical laboratory work, and patient care, has rushed to Kasai. Their mission? To ramp up disease surveillance, provide critical treatment, and dramatically improve infection prevention measures across local healthcare facilities. But that's only half the battle. Risk communication experts are also reaching out to local communities, using clear language and practical advice to empower people to protect themselves and their families. And this is the part most people miss. Responding to Ebola in Kasai isn't just a matter of expertise, it's a test of logistics.
WH is sending 2 tons of crucial supplies, including personal protective gear and portable lab equipment.
But the region's remote landscape presents enormous challenges. Reaching the epicenter from the provincial capital, Shikapa, takes at least a day by car, and air travel is limited. Dr. Mohamed Janabi, WH's regional director for Africa, made it clear, "Our response is determined and fast-paced, aiming to stop the virus from spreading further and save lives." Congo's health system has valuable experience from past outbreaks, and officials are banking on this know-how to rapidly expand response efforts. Yet, a difficult truth remains. With the outbreak still unfolding, case numbers may rise. Health teams are actively searching for anyone who might be infected, striving to provide immediate care and curb further spread. Controversially, some might question whether the available resources are sufficient, especially with new cases emerging.
In a rare but hopeful advantage, the DRC already have a stockpile of Ebola treatments and 2,000 doses of the Ervebo vaccine, specifically effective against the Zaire strain, which are stored in Kinshasa and ready for emergency dispatch to Kasai. These will be prioritized for at-risk contacts and health workers on the front lines, potentially turning the tide against the outbreak. But does the shadow of the past loom large? The country's last Ebola flare-up struck Equator Province in April 2022, but authorities successfully contained it in under 3 months. Kasai itself hasn't seen Ebola since back-to-back outbreaks in 2007 and 2008. Altogether, this marks the 15th Ebola outbreak for the DRC, since the disease was first discovered in 1976, a staggering reminder of its persistence. For those unfamiliar, Ebola virus disease is both rare and terrifyingly dangerous. The illness can be fatal for humans, transmitting from animals, especially fruit bats, believed to be its natural home, through contact with infected blood, body fluids, organs, or tissue. Once inside human populations, Ebola spreads relentlessly via direct contact with the bodily fluids of infected individuals or contaminated objects. And here's the debate worth having. Given the Congo's long record with Ebola, are the current response strategies enough to protect vulnerable communities, or is more radical action required? What would you do if you were tasked with halting this deadly virus? Do you believe rapid vaccination and resource mobilization will be enough, or is a broader international response needed? Share your thoughts, agreements, or challenges in the comments below. Your perspective could change the conversation.